Dr. Rajat, welcome on our platform, Spiritual Doctors for Holistic Health.
Thank you, sir.
We are running this platform for last 3.5 years, and we discuss various dimensions of health through experts like you. So now, platform is all yours, and kindly educate us the importance of movement.
So as you said about the name, so I'll tell you, movement is movement itself, but what we've done is we've taken 4 pillars, and the first one being, which is totally ignored otherwise. So everyone would think that, because I run, because I talk about exercise, it's all about that only. It's not. The very first thing is, how is mental health? And with mental health is connected sleep. Because if you're not sleeping well, because 1/3 of the life, 8 hours of life, you should be sleeping. But if you're not sleeping well, you cannot be ready for the next day. You have not absorbed current day today, and then the tomorrow that is coming, you're not ready for it. In every sense, mental health, physical health, everything. So if you're not talking about that, there's no point talking about, say, how much you've exercised and what have you eaten and anything. First, sleep well. Now, sleep well can't happen if you don't have good mental health. So it's, again, connected with each other. So mind, mint, that's where we are kind of coming with that term, like why mint? Again, as I said, mint can be connected to nutrition as well. So it's fresh nutrition, the minty leaves and all that stuff. But again, when we're talking about all of this together, whether it's nutrition, whether sleep, mind, physical activity, all put together, what we are saying is you become your better version, you become new. So, again, mint can be used for things that are very minty, means new, fresh. Minting money. So it's not only about physical, not only about you. At the end of the day, you can be a Guruji and all that, but as they say, bhuke bhajan na ho Gopala. So kuch to chahiye. So it's very, very important that we take care of the mint part, the money part as well. And we can't be all sadhu babas and all that. We are living in a real life. You have a family. So we need to be addressing all of that. We need to be realistic about it. So when we talk about physical activity, it can't be do this for 4 hours a day. I mean, what about the rest of the day? What about regular life? What about going to the clinic or whatever else we do, whatever job it be? So how do we optimize that time? And there, I've been involved, as much as I don't look like, but I've been involved in strength training as rehabilitation, strength training for better performance, strength training for better health since 22, 23 years now. And where we've used exercise using machines or without machine strength for a back pain, knee pain, dialysis, heart diseases, long before it's now become very popular, but we've been doing it for a long time. And I was heading something called Kaiser Training. Kaiser Training is a chain of rehabilitation centers in mainland Europe. And I was heading the UK one, the London Center. This is 2004 to 2006. And where if people would come in with back pain, disc bulge, sciatica, whatever, neck pain, knee pain, shoulder pain, whatever it be, we would actually get them on machines, strength training machines. And they would have been suggested surgeries, but we'll actually get them on a program where over 3 to 6 weeks, they could get off it. Now, the main thing we're doing is the magic is not in the machine. The magic is in empowering that patient or that client or that person, saying, you can help yourself. I'll show you how. So it's not like teaching them anything, it's guiding them, what they were doing previously. So that's a very, very important part that, I've been at it for a while. Luckily, I was in the right place, right time kind of a thing, learning from the best. But again, as I said, without the 3, physical activity can't do much. Without sleeping well, without the mind, without eating well. When I talk about eating, think of eating like you buy a Ferrari and you put kerosene in it. I mean, if you think yourself as a Ferrari, then might as well treat it as that as also. Then eat like that. Eat well, quality-wise, quantity-wise, everything. Another thing that I've learned is, with this whole exposure to global, wherever I've been, I think Indians don't value themselves enough. We don't respect ourselves enough. In a Western world, if there's one brick, one little wall, they'll tell you a story like forever. this is 50 years old and da 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 da. I mean, kya bekar ki baat. So if you go to Sanjay 1, there's a wall there, and most people don't know. Most people who live until you don't know this. That wall is about 1500 years old. Lal Kot. So 11, 12, whatever 100 years ago. So basically, it's from the Rajput clan and all that is there. Now, point I'm trying to make is it's in ruins totally. So we're not even going back to when Ayurveda, when all of that. Don't even worry about that. More recent stuff, we don't value that also. So all I'm really saying is I think we, the foreigners, the Westerners, repackage what we've always known and they sell it to us and we're like, oh my God, amazing stuff. So that's the thing about movement medicine that we've done. And I wrote with the colleague of mine, co-author of mine. He's in UK, London. He's a associate lecturer at London School of whatever, I'm forgetting, UCL, University College of London. He's there. And he's very deeply into sports and exercise and all that. So idea behind the book was, let's make it simple so that anyone can read. We've given a lot of stories, like, how, whether with a heart disease, whether with aging, how things can change if you're just using your common sense better. Don't bank on doctors. Doctors are supposed to be your guides. Doctors are not supposed to be in the driving seat. You need to be in the driving seat. So as soon as that shift happens, things are very different then. So yeah, that's what we've done with it. Dr. Ranjan, any questions I can answer? Otherwise, I can carry on forever really with this.
There is question by Dr. Pratima. Any Kaiser training center in Bangalore?
No, there isn't. There isn't. So I'll tell you, I mean, don't worry about the name Kaiser and all that. I'll tell you what it is. Actually, I'll tell you in detail. Basically, they have strength training machines. Now, back in 2004 and all that, so 20 years ago and all, the machines that were there in regular gyms were not high quality. They were not good. They were bad. But what we had at Kaiser training was an American machines called Medix. Very, very good, biomechanically, very, very good. Very good how they moved by dynamics and all that. Now, on top of that, so having very good machines, on top of that, what we did was the protocol that was used to exercise was again combining the Swiss and the German systems. So that's where Kaiser comes in. That's where someone called Arthur Jones comes in. Arthur Jones has been at the cutting edge of exercise as rehab, exercise as performance. I'm talking about 70 years ago, not recent, like, long time ago, 1950s, 60s and all that. He's the guy who's like how you exercise is put by him. And that's what it was. Now, what I'm saying is in India, now mediocre gyms that are there have very good machines. Okay. Now that's one part. How you exercise, I can tell you about that. How you exercise, there are some mistakes that are made by everyone. Everyone wants to have dola sholas like Salman Khan and all that, right? Now, that is the wrong approach. So first thing first, when we talk about strength, as we age, more than cardiovascular exercises. So, when you go to the park, what do you see? You see everyone who's there in the park walking. They're almost always about 45, 50, 60, 70, 80s and all that, okay? But those people are not doing strength training. As they're getting older, the muscles are getting weaker very quickly. So the very basic reason for all the disease creeping up, they're not strong enough as they were when they were 35 years old, 30 years old. So as you age, you need to strength train, very important. Okay, so what I'm really saying is everyone above the age of 35, 40 should be doing strength training. That's one thing I'm saying. Second thing, even people who are going to the gym, they, as I said, Salman Khan, Dola Sholas, right? So they are taking too much protein, which they should not be taking. There's no need for overdoing with this protein business. Eat well. If you eat your food like medicine, if you eat your food very less in quantity, and you eat your supplements like food, there's a problem there. And that's what today is happening. So eat well. You do not need supplements as much as is being said by the world, right? Eat well. And Indians If you look at the thali, for example, it does, it caters to everything. And then we can go deeper in it if you want. So there's no need for supplements as much as being promoted. Someone is making a lot of money, and you're the one who's losing all of money and more, health as well. The other thing is you're banking on trainers. Most trainers don't know what is to be done. Again, besides the muscles, they don't know what is good, what is bad. Now, we're not going into bodybuilding competitions. So what needs to happen is don't worry about heavy weight. Start with low weight. But the mistake again you make is you carry on with the low weight forever. 2 kgs, carry on forever, 20 years and all that. People do it wrong. Remember in school when you do 1 + 1, and if you do 1 + 1 for 10 more years, what you become really good at is 1 + 1. You never know what is 1 multiplied by 1, by the way. Okay? So same for a muscle. If you're doing a light weight and you carry on with the same weight, you will not get stronger. So you need to start increasing the weight. So start increasing the weight. Don't do rapid movement, very quick movement, explosive movements. Do it gradually. Injuries will be reduced markedly. Most patients who come to me from gyms are courtesy, the instructors, they don't know how to train. And I get my patients from gym because of the gym instructors not knowing the job properly. So move slowly, increase the weight slowly, breathe very easily, slow in, slow out. Injury will not happen. Intra-abdominal pressure will not increase if you don't hold your breath. So if you keep breathing in, breathing out. So all I'm really saying is know these basic things. When you sit on a machine, figure out which machine works, which body part. As soon as you're doing, say, a bicep curl, but you're getting pain in the back, there's something wrong. So figure out which machine, which body part. That's where the strain should be, should not be anywhere else. So once you've figured out these 3-4 things like that, you've created a Kiza training in Bangalore, Bombay, Hyderabad, everywhere, right? So idea is have a very basic idea what this is. And again, I keep creating videos and all of that, and happy to share all of this as well, like, how with each machine we do things. But become aware, what is that machine supposed to do? What is that exercise supposed to do? It's not even about the machine. Imagine you're doing a floor exercise. You're doing a dumbbell exercise. Be very clear what that exercise is supposed to do. Which body part? If it's hurting anywhere else, you're doing it wrong. Okay? Never do it with very quick movement, wrong. Just do it very slowly. If you're doing high intensity strength training, do it 3 times a week. Let it recover enough. So those are fundamentals of strength training that most doctors would not know, most trainers won't tell you. You do these right, you will benefit a lot, and injuries will almost not happen. So.
Okay, so one question from my side will be, is it possible to build the muscle strength without equipment as well?
Easily. So if you're doing a push-up, classic example, everyone wants to do a push-up, right? That's the classic one. We talk about strength training, everyone wants to do a push-up. The mistake we make with a push-up is we go on the floor right away and we're trying to do that. The problem with that is, imagine if someone is 65, 70 kgs, or 60, let's stick with 60. You're loading 60 kgs right away, and you can't do one single push-up ever. Now, if you go to the gym, all those guys with, as I keep saying, dola, sholas, all that, you ask them to do one single push-up, you'll be surprised. Most people cannot do one single push-up properly. That is because they've not progressed properly. So I would say get into the push-up position, have your hands right in front of your shoulders, stand against a wall about like 6 inches away or something. And then what you're doing is you're just going this movement, okay? So you end up here and you're leaning against the wall like that. So you're doing a wall push-up. So in a position like that, this is the kind of movement that's actually on, right? Now start with a wall at the shoulder level height. After you got better at that, after you kind of got comfortable with say 10, 11 repetitions of that exercise over say 1 week, 2 weeks, lower the level a little bit more, go down by 6 inches on the wall. Do that again for 2, 3 weeks till you become comfortable with 10, 11, 15, 20 of them. Then you can go to a table height, for example, again for 2, 3 weeks. Then a chair height, then a stool or whatever. What I'm saying is before you do the floor, 2, 3 months, you should not do a floor push-up. So we can come up with gradually building up with any of the exercises. Squats is my favorite exercise, for example. I really love squats. Now, squats, Most people say if you have knee pain, you should not do it. Don't people sit down on a sofa even if they have knee pain? Don't they go to the toilet, the eastern one or the western one, when they have knee pain or a back pain? So when you sit on a chair, you've done a half squat. When you get up, you've done a half squat. So full squat happens as soon as you sit on the chair and get up again. So anyone does it daily so many times. All of us are doing it. Now we need to break it down into smaller units like that, all these exercises, and we can do lots of them. Another exercise that I really like is calf raises, heel raises. You're standing and you just raise your heels off the ground like that. Um, your calf is like the second heart of the human body, and it pumps that blood back to the heart again. So there's lesser load on the heart, there's a lesser load on the rest of the body. So all I'm really saying is we can do an amazing job. We can make a very, very good program for 2-3 years, just doing body weight exercises. There's no need. I mean, yes, you should do dumbbells and, maybe machines as well, but it's not a necessity. We can do a lot without doing that. Look at gymnastics. People who do gymnastics, look at their bodies, right? They're very, very well developed without any weightlifting. So tons that can be done, pull-ups that can be done, and other things.
Okay. And the frequency of this resistance training should be need to be twice a week or what?
So very, very good question. Very important one. The main reason of injury for people who are exercising, whatever exercise, whatever sport, the number one reason for injuries to happen in them is overtraining. Whether someone plays tennis, whether someone runs, whether someone goes to the gym, is overtraining. Now, your body, when it exercises, whatever form of exercise, it needs time to adapt and recover and get stronger, whatever exercise it be. Now, the thing is, depending on intensity, it takes longer. If the intensity is higher of that exercise, it takes longer to recover. Now, when we exercise strength training, I mean, if someone goes to the gym currently and you've done bicep curls, okay, you've done 2 sets, 3 sets, 1 set of decent weight bicep curls. Right after that, picking up a bottle to drink or a glass to drink, it's a lot of struggle because now your biceps are very tired. Okay. Again, you've done your 4 hands or whatever. The thing is, your fatigue has set in. So if imagine this curve, this line here is time, and this is strength. So time and strength. You started from here. After the strength training session, the strength in the body is actually going down before it goes up. So it first goes down. Okay. Now, if you catch the body in 24 hours, you caught it when it's actually weaker than it began. And if you do it again and again and again, basically that strength curve is going down, 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 down over a week, 10 days. And then an injury is waiting to happen. Now, we can give it a diagnosis or whatever term. But the point is, it's simply overtraining. That's the problem. So the point is, we should be having a gap of 48 to 72 hours between 2 high-intensity strength training sessions. If it's done sooner than that, injuries will happen. So don't do every day if you're doing high-intensity strength training. If it's very lightweight stuff, chalta hai, no problem. But if it is high intensity, 3 days a week is good. Some people who've done very high intensity, and if you haven't done high intensity, you would not, most people will not know what that means. It's still failure, and then even twice can work in a week. Ideally, I would say 3 days a week with 1 day in gap in between is enough for strength training.
Nice. And one question is coming from yoga. Since our Prime Minister has declared a Yoga Day, and a lot of people are doing yoga, and they are quite a movement in yoga as well. It needs a strength as well. So, what's your comment as a medical doctor? What is your comment on the practice of yoga?
So my main thing with yoga is it's been abused a lot, the term yoga. Yoga is not just asana. So yoga is more than asana. And what we've done is yoga has become popular in India because of the Westerners, because of the Americans again. A guru from here goes to America, New York, Washington, whatever, and he becomes popular there. And then yoga becomes popular in India. I mean, that's the history of yoga in the last 70 years or so in India. Now, what I'm saying is they forgot yoga is supposed to be a way of life. Yoga is not about just an asana, just a breathing and all that. So one thing is, are you a good person? It starts from there, right? Practice yoga. Practice yoga bigger than just moving your limbs around and all that, and staying in asana in whatever way. So that's one very important part. And again, yoga is not 70 years old. Yoga was practiced in gurukuls. Right now we're talking about, we're in the festive seasons and perfect time to talk about this. Gurukuls back then, whatever, 3,000, 4,000, whatever time we would want to say, that was practiced then. I'm a visiting faculty at National Police Academy, and I'm very proud of this, as much as people would say, IPS this and police that. But there's a very important connect between Gurukul and what we do at the academy in Hyderabad, at the National Police Academy. After they've cleared the UPSC exam, based on their ranking, people who call it, get into the whole IPS bit, they go there, they train there for 44, 45 weeks. I'm the one in charge of making sure injuries don't happen. I'm the one in charge of, or at least contributing to optimizing the training during that time. Now, imagine these are people who cleared the UPSC exam. They spent 2 years, 3 years, 4 years, 5 years after graduation to study for that exam. They become very weak, very unfit during that time. They're sitting in a room and studying all the time, right? 80, 90% of them are very unfit, super unfit. Whoever created the program there long ago did a beautiful job of something very similar from a Gurukul. Unlike most of our schools, unlike most of our colleges in the country. They have 8 courses outdoor, they have 8 courses indoor, very much like Gurukul 4,000 years ago, right? Now, 8 courses that are outdoor, I'm involved with the outdoor program. Okay, so I'm a visiting faculty only for the outdoor, I'm not for the indoor part. Now, there it would be, you have to learn unarmed combat, so how to kind of fight without any sticks or guns or whatever. How do you take care of yourself? So all IPS officers are trained in that. All IPS officers are supposed to run 16 kilometers by the end of the program to qualify to be there for the passing out parade and all that. So the fitness they go through, the level is amazingly good. Now, what I'm really saying is, it is being done in the country, okay? And we need to respect these guys, because by the time they wear that uniform, they really deserve it. They really do. Because they've gone through that hard time, and it's as tough as an IMA, all that, Indian Military Academy, all that. But here we don't have an option of failing them, because we have to spend a lot of time, making them get there. So we don't throw them out. We make sure they kind of, become as good as that. So that's the major difference we have between the National Defense Academy, IMA, and this academy here. Now, I forgot the question that you were talking about yoga. So the thing is, it becomes very, very important that, that yoga we practice as a way of life, but we don't limit it just to asana. And now, if the question is, and because again, when our Prime Minister is talking about it, he's not talking enough about the whole yoga thing, all right? He's talking about asanas, sadly so. Even if we talk that as yoga, we need to be not treating things in medicine or health as religion. It is very important. We need to kind of, and hence I like the word spiritual more. So we need to back off a little bit and look at the bigger picture. Now, what I'm really saying is, when we do that asana, there are some very, very good things in it, any of them, but there are things that are being missed out. In the sense, not enough strength is addressed, which could have been done slightly differently if we were totally focusing on strength only. I love Surya Namaskar, for example, but I have a problem with it. Most people want to do it without knowing, because it's a combination of many asanas. It's not one single asana. It's a complex exercise. Now, the problem is, if you haven't actually mastered one of them and you try to do all of them, effectively doing all of them wrong. Okay. Now, out of all of them, if one is wrong, you might think you're doing very good, but that's the one that's causing you knee pain or a back pain. So point again is, everyone talks about Surya Namaskar, 108 Surya Namaskar, all that. Ek to karo pehle yaar, push up wali baat, matlab, that'll be good. So again, please, let's break it down into smaller units, all of the asanas. Let's do them correctly. Understand, like a classic problem in today's world is, because of long sitting, hips and low back is very stiff for most people. 90% people have a very stiff hip and very stiff lower back. And it's a catch-22 situation. I'll just show you, I have one here. So your lumbar spine here, your hips right here, then next door neighbors. Now, first rule of orthopedics is, look at So right here. So lumbar spine here and hips are right here. And if we go back to our first year MBBS and think about the first rule of orthopedics, one joint above, one joint below. Wherever the pain is, look at one joint above, one joint below. So if someone has a back pain, why are we not looking at the hip? Why are we not looking at middle upper back? If you have a knee pain, why are we not looking at the hip? Why are we not looking at the ankle? Orthopedicians don't even examine the knee. I mean, forget about looking one joint above, one joint below, right? So all I'm really saying is I'm just trying to connect it to the yoga bit. When we do that asana, have we assessed the body? Have we seen what the limitations are? Have we realized why that asana is being done properly or not? And if not, don't jump to the asana. Do some mobility exercises, do something simpler, do whatever movement first. And then we combine things. But yet I'll say, even if someone is doing only yoga asanas, they're yet missing out on strength training, they're yet missing out on cardiovascular. So we need to have a very open mind in every sense. So yoga is very important, the asanas are very important, but there's more. And again, as I keep saying, yoga is more than just asanas.
So you mean to say that yoga need to be practiced under medical supervision, medical experts like you?
So I would say actually a platform like this and a practice like a platform like lifestyle medicine and all that, what we should be doing is we should be the people making courses, why only for doctors, even for paramedics, even for trainers, all that, saying, how do you assess someone who comes for exercising with you, right? How do you assess? I'll again give you one more. So, this is the head here, missing head here. So again, head would have been here, the skull. And there's the backside. This is where the shoulder blades would have been. Now, shoulder blades are basically swimming, literally, over the rib cage. If your posture is poor, and then you sit in a certain way, 8 hours a day, 12 hours a day in front of a computer, and then you go to the gym, for example, you're sitting in a position like this to do your pull-ups and all that. And then you're surprised why you're having shoulder pain. Shoulder pain is not because of capsulitis. Shoulder pain is not because of a tear here. Shoulder pain is because your posture was going wrong doing that exercise. Now, if the gym trainer does not know that, or the yoga guy does not know what should be assessed, they're in trouble. They're creating more pain, more injuries permanently, rather than fixing things. So all I'm saying is, why don't we actually have some sort of a platform where we kind of educate such people, saying what is the basic assessment? How should you prescribe exercise? What should be the holistic view to it? Breathing. I mean, everyone talks pranayam, but most people who talk pranayam, yet when they come to me, they don't know breathing. So saying breathing keeps you alive, yeah, pran, yam, right? So we need to break it down a little scientifically for them, make sense to who practices, who the practitioner is, who's teaching, mentor, all that. They need to know a little bit of science behind it as well, medicine and science behind it.
Nice. Another question is there any disparity between arm muscle in women? The arm muscles are more built up in female.
So not really. So I'll tell you something very interesting about this. This is very recent research that's come out, and I'm kind of going away and I'll come back. Please ask me the question again because I forget questions. I go away a bit too much. So what has happened is in the recent research, and I think I said that at the lifestyle medicine, when women exercise or pick up exercises, when they start running, they give up, they stop doing it very frequently, very often. Okay. They will pick up running, they'll give up in 2 days, 5 days, 10 days. They'll go to the gym, they'll give up after some time. The classic one is New Year resolution. You need to understand the business of gyms. Basically, for 1 week, everyone comes, and after that, for the whole year, no one comes to the gym. Women being more than men who kind of drop out. Now, I'm not trying to put women down. There's a very good background story to this, or a reason for this, because women are playing so many roles in society. Men just do it for themselves and no one else. So effectively, women have to take care of the house, have to take care of the family, have to take care of the husband and whatever, in-laws, all that stuff, work, all that stuff. Their own health is not the priority. So the first thing to drop is your own health, and hence whatever exercise they start, they stop very quickly. All right. So that is one fact we know, that women quit on exercise very frequently, very often. But here is the catch. When they start doing it and when they're consistently doing it, cardiovascular strength training, all that, they start getting stronger more than men with half the effort. So they put in half the effort of men, but stay consistent. They're getting as strong as men with half the effort, right? With half the weights, all that. So they do get stronger over a period of time compared to men if they work out as much as them. Just that the problem is they don't get started enough. I mean, they're stopping so often. Now, that's one part. When we talk about the arms and all that, that's not necessarily true that, arms are weaker or stronger than men. That's not there. But endurance-wise, again, what is very fascinating scientifically, men talk about pain, when there's a paper cut or something, they complain about, hey, Bhagwan and all that stuff, right? Women talk about pain when there's pregnancy happening. So men pain is on a scale of 10, 1 is a male pain. On a pain scale, women pain, 10 being, the labor pain and all that. So men complain about pain all the time for nothing, no reason. So when you talk about endurance, women can take endurance running when it comes to, when we talk about ultra marathons, all that, women can beat men. They can't do it in 100 meters, not yet. But as the distances get longer, the gap between men and women get lesser and lesser and lesser. And over a period of time, they start beating them also, right? It has happened to our race in Ladakh. This is 2011, 222-kilometer run. There was a lady, 47-year-old or something. And there's a documentary of it. I can share the link. It's on YouTube. And she beats a guy who's a boxer who comes second. And this lady comes first. And she's asthmatic. And she's running Ladakh, 222 kilometers. And there are a lot of cases like that where women have beaten guys, very good runners, both men and women, where women have beaten guys because they can sustain, they can take pain a lot more for longer. Men can't. Men are just, sissies. They complain too much.
Okay. Any other questions, friends? If you have any question, kindly feel free to ask in the chat section.
I'll just say about, if there are no questions, I'll just say a bit about the sleep. Now, or even sleep and mental health, I try to combine the two together. So sleep, a very important part is, please, this whole thing about Einstein slept for 3 hours and, so-and-so slept for 2 hours, all that. Remember a basic rule in life, a bell curve. Now, there is no fixed number for anything. It's always a range. And like a bell curve, less, more, and somewhere like, average-ish kind of a thing. We talk about 7 to 9 hours of sleep are required. Some require more, some require less, but 7 to 9 is ballpark figure, good number. Some of us do a great job with less sleep. Some of us need more sleep. If you're getting up not fresh in the morning, if you're getting up grumpy in the morning, there would be talk by psychologists about, are you getting, is that a symptom of depression? Okay, are you not sleeping well enough? So that's one part. Please figure out, are you sleeping well? Now, how do you work with that? One very basic rule is, again, we can talk yoga, we can talk all that, but the thing is, I'm just saying from my point of view, very basic rule in today's world, can we start sleeping today, not tomorrow? So don't sleep tomorrow, sleep today. And again, when you're sleeping today, can we sleep at around 10-ish, right? Not 11, not 12. So kind of keep pushing yourself this way to 10 p.m. latest. And then it would be about dinner. So can dinner happen 2 to 3 hours before? Because if it's going to be dinner close to sleep, you can't sleep well. So sleep is a very important part. Please take care of that, because without that, all this thing about movement and physical activity, you're not getting anywhere really. Okay. And one thing I always keep telling patients who come to me, take out time for yourself, because if you don't take out time for yourself, no one will give you the time. So basically, if you're not interested, then to complain, doctor chore hai, yaar, aap kaun se usse achhe the? ठीक है? So if you don't take care of yourself, don't expect a doctor to take care of you. Okay. So whether when you're sick or whether when you're healthy, please, you should be in the driving seat. You'll be surprised most of the times you can get out of it if you are in control. Listen to all of us, but you need to be the one who needs to take that final call depending on what makes sense to you. It should make sense to you. Okay. And to the doctors in the group right now who are listening, treat them as equals, because as soon as we do that, they value us a lot more. They respect us a lot more as soon as we're treating them as equals. But I don't wear a white coat, for example, in the clinic. I don't have that pipe around my neck called stethoscope. I don't do that because who wears a white coat? It's called a lab coat even today, lab coat. So basically, it's a guinea pig who's coming and I'm experimenting on them. That's a wrong approach totally. Okay, so why the white coat? And why the stethoscope? I mean, I don't usually need to auscultate anything. Even if I do, I mean, it's there in the corner. But it's funny. I mean, radiologist and pathologist having a stethoscope around the neck. I mean, don't overdo this stuff. So I'm saying be equal to them. I have the same chair that I sit on versus the patient, for example. So it's not like mine is bigger and all that glamorous and all. It's same. So all I'm really saying is we don't realize on these things. I go to the reception, for example, to get my patient in each time with each patient. I would shake their hands. Rapport building is happening. All I'm really saying is they pick up on things which are not said. They pick up on things the way they're treated. Okay. They pick up on the negatives that you say. You could have said 10 positives, one negative is bad enough. And they'll remember it for 10 years or life. And it would seem like a death sentence to them. So all I'm really saying is your language matters. Again, one of the things that I do is I do a 45-minute session with the patient. And when I do that, it's very fascinating. I'm just trying to remember yesterday's some case where it was, I love doing the consultations because it's pretty much like Sherlock Holmes, because you have to listen to them and you have to listen to them and you have to listen to them. And after about 30 minutes or something, they'll remember something. They'll not even remember. They'll say it in passing. कि by the way, तब ये हुआ था करके, right? Yeah. I'm just trying to remember one patient that I saw yesterday. He has back pain for last 10 years. And everyone's told him it's in his head. And he's very clear that it's not in his head. And we can argue about that. There can be a 1-hour session about this only. But the point really is the doctors are telling him repeatedly, they can give it in writing, he'll never get better. He's faking it. It's nothing there. Because the MRI says there's nothing in the MRI, there's a slight bulge, L5S1, there's a slight bulge. And he's been in pain for 10 years. He was in the bus from Meerut to Noida 10 years ago. And back then, if you remember, the roads, they were not very wide, they were narrower, that highway that was there. And the bus guys, the DT, whatever buses, those DTC and all that, they used to do off-roading, right? So they're never on the road, they're on the off-road. They're up and down like that. And at one stage, he was airborne for a while. So he kind of took off in the bus and he was in the center of that seat. And he went up, hit his head on the top, came down, there was some pain. And he was like, yeah, I deserve it. I mean, I'm in the bus and it's such a good ride, fun ride. Some back pain is bound to happen. In 2 hours, when he got off at ISBT, he could not get off the bus. And he had to be taken off on, ambulance had to come. So he had to be taken out on a stretcher. Now, in this story, when doctors say it's all in his head, I mean, his head hit the top and all that. But the point is there's a definite cause to his pain. Okay. Now we can argue, is the pain physically there or it is amplified by the brain? Because all of the pain that you experience, all the pain that you experience in the world is up here. Even when your arm is cut, when you're pregnant, delivering, it's all here. Because if it's not here, because this is where the brain is, nerves supply wherever. Because of the brain, if we cut off those nerves, there'll be no pain, any of that pain. Okay. So it's all of it is here. So to say it's here and you have no real pain is rubbish, because those doctors don't know what the hell they're talking about. And these are very big names that I'm talking about, like heads of departments and all that in all the top hospitals. Now, what I'm saying here is a patient like that, if you empower that guy, if you tell that person, guy or girl, it's your body, your life, I can be a guide to you. But the point is you need to, one, be wanting to get better. That's a very important one, because some of us get into a space where we do not want to get better. Okay. But you tell them, you be in your driving seat. Think of me like a Formula One. Think of me, I'll come clean the glass, I'll change the tire, I'll fill the fuel for you and all that. And my team. But the point is, I'll guide you how to do it. I'll be your manager in the pit, right? Team manager. But you have to drive, yes. I can't do anything for you. I can guide you, I can show you the way. If we start learning this, which we don't, people who are very senior, some who've taught me as well, some are very good and some are, not necessarily, they've lost the way. But, it's very important to stay very humble and, actually put them in the driver's seat, and you'll change the game for them, no matter what you're dealing with, whether it's a cardiovascular, whether it's a dialysis. There was some issue with dialysis today. And I was sharing earlier, Dr. Ranjan, that bit with you. There is a chance dialysis patients can get off dialysis if they are doing proper strength training, if they're doing proper cardiovascular stuff. Okay. So very important. Get people on it. If someone has a knee pain, someone has a back pain, someone had a knee replacement, you can still work your back, you can still work your arms. Think about which body part can move. Okay. So don't say nothing can be done. Sorry, Dr. Ranjan.
I want you to elaborate this point that dialysis patient can practice muscle strength training and can reduce the frequency of dialysis and even can get free from the dialysis process. Can you elaborate this point?
So again, let's go back to why is dialysis done. Dialysis is done because the kidneys are failing. What is a kidney? Kidney is like a filter, right? So the filter in the body is not working appropriately. It's not helping the blood stay as healthy as it should. I mean, very broadly saying, right? Now, effectively, there's a failure of the filter, right? Why is that happening? Because the waste product is a bit too much and the filter is failing. I mean, so we're going back a little bit, right? Now, why is the waste product more? Because your muscles are not working properly. So a poor muscle, there's more waste product. Think of it like an obese person. There's more waste product with an obese person kind of a thing. Think of it like that, right? When the muscle starts working better, the load on the kidney will be lesser. The load on the heart will be lesser when the muscle is working better. If it is more fat, there's more load. So fat is a liability, muscle is an asset. Okay, so fat is a liability, muscle is an asset. So as soon as we are working with the muscle, and muscle doesn't convert into fat. I mean, a lot of people keep saying that that's rubbish. It doesn't. Just that the muscle gets stronger and fat kind of over time just, burns out. But the point is, we all have muscles. It's about activating those muscle fibers, doing those exercises, gradually build it up. We don't have to do very heavy weights, very slowly. Without weights, can we be doing this simple movement? Can we be doing stationary bike, a recumbent bike very slowly? Get those muscles in the quads and the calves and the glutes and all that working a little better. Now, suddenly over a period of time, I mean, when I say suddenly, I mean over like a month or two, the load on the kidney will be less over a period of time. So what will happen? The dialysis that's being done, say 3 days a week, right? There could be a very, very good chance that when we look at those numbers, when we do the blood test and all that, it'll start changing, and you'll be like, but is there a need for 3 anymore? It's feeling much better can be with 2 as well. So point really is, as soon as you're starting the muscle, and if there's a system, as we are very clear today, it's not just muscle being, just an accessory thing. You are loading the kidneys lesser. So you're doing what dialysis was doing in any case. You're supporting the kidneys because the muscles are working better. Okay. Then comes the point about cardiovascular. Again, when your cardiovascular fitness is not very good, yet again, there's more wastage. You're banking on, you need more oxygen because you're less fuel efficient again. Okay. The more fitter you are, you breathe better. A simple example is try climbing stairs, someone who's unfit, and 1 flight of stairs, and they are breathless by 1 flight of stairs, even if they go very slowly. So think fuel efficiency wise. You use so much oxygen to climb that 1 flight of stairs because you are unfit, strength wise and cardiovascular wise. Where is the load? On the kidney, right? And the heart. So effectively, if we are getting gradually fitter with our physical activity, whether it be both combined, strength training and cardiovascular. Okay, now we can give it whichever term, we can give it Pilates and whatever else and yoga and whatever. Broadly speaking, those are very important. Mobility is very important. We are meant to move. Don't let anyone tell you that, with a back pain, knee pain, you should not be moving. I was in a setup earlier in India, it doesn't happen often. The day of the surgery, we would get people of back surgery, especially knee surgery. We would be getting people moving the same day. We would be getting them sitting them on machines the second day or the same day. Point is, it is not about movement. It is about how much you load it. Don't load it enough. Start very slowly. If you don't start soon, there is going to be a very mental block that I can't do it. And then that shows in the body physically because you made up your mind. And whatever disease we are dealing with, whatever dysfunction we're dealing with, same story. Cancer is a big one. There's so much research to show what role, whether we call it lifestyle medicine, whether we call it physical activity, whatever we call it, the point is there's a major role in cancer that it has, just that it's such a life-threatening thing that most people don't to experiment. Very important. I mean, if you get a chance ever, wherever, please tell them, to get physically active, change the lifestyle as well. Very important.
Okay. So, very interesting input, Dr. Rajat. Hope more people will understand the importance of muscle building and exercise. There are questions, exercise for low back pain. My dear friends, for these things, we can watch the video channel of Dr. Rajat. It is with the name Movement Medicine. So lots of videos are already there.
I'll just say a few things though. Can I, Dr. Ranjan, just comment on this?
Yeah, please.
Yeah. So when it comes to back pain, again, remember the things that I've just said. If you kind of paid attention, it covers all of it. So just think about one joint above, one joint below. So again, when we say back pain, okay, so when we're saying back pain, the hip is usually very stiff. So if you're doing, I'll mention things, so I'll not show you, but you can Google it or you can look at my channel or whatever. If you're doing a gluteal stretch, if you're taking the knee across, okay, that works wonderfully well, getting the hip moving. So that's a gluteal stretch. Just look for gluteal stretch, you'll find it. Then there's something called a piriformis stretch. Piriformis is a deeper muscle just over the sciatic, which causes the sciatic pain also sometimes. So the piriformis syndrome in the butt, and the nerve goes like that. So basically, that tends to be tight as well. So piriformis stretch as well. Now, again, remember, hip is a ball and socket joint. Most of us can't sit, chokdi marke, and right now this whole prayers have happened and all that festive seasons. Most of us can't sit on the floor anymore. So as soon as we're doing this movement, the two movements I'm talking about, gluteal stretch and the piriformis stretch, you're opening up the hip a little bit. One very big limitation is, this is the front, remember there's the front. We are very good with hip flexion. We know how to move it forwards very well, but we've forgotten that 30 degrees, it can go backwards also. And the body's forgotten that part, going backwards. Okay, so back movement. So lying on the tummy and you're raising your knee off the ground, bend your knee and you're raising the knee off the ground. It's called a donkey kick as well. So you can stand and do it as well. So it's a backward movement of the leg. Okay, so as I said, one joint below, one joint above. So that's get the hip moving a little. About the lower back, and actually, I'm glad you asked this question. When we talk about the spine, from the skull up till where the belt is, the 24 bones, the 7 here in the cervical, thoracic 12, 5 lumbars. And the 24 joints, 24 bones, 24 joints. So effectively, what is the advice that should be given versus what is given? When there's back pain, what are we told? Lie down in the bed. Yeah, it's the joints. You tell that person to lie down and it becomes stiffer. And there was a spasm to begin with. What do you expect? It'll get stiffer, right? So it is very important we get that back moving. We get those joints moving. Maybe there's pain here. Fair enough. There's no pain here. We can move this part. Okay. Now, there's a very, again, favorite exercise of mine, like an orange squeeze. So imagine there's a ball, tennis ball between your shoulder blades, and you're doing this kind of a movement, right? You're doing this kind of a movement. You're moving your upper back, your thoracics very well. Okay. And the logic really is your thoracics are here. You kind of move them. And your lumbars are here. There's going to be lesser pressure when the thoracics are moving. One exercise I want everyone to do is interlace your fingers like that, like, like this. Put them behind your neck and bring your elbows in front. Okay. And you're writing alphabets. You're writing A's and the B's with the elbows. So you're writing an A like that. Just try that, please. And a B and a C Now, what you're doing is you're moving your thoracics very well. When you move your thoracics, your lumbars will be under lesser pressure. Also, what it does is your breathing capacity will improve because where are the ribs attached? Thoracics. That's where the lungs are within, right? So once you move that, the pressure on the back will be lesser. And what I'm trying to give you is I'm not trying to say which exercise, I'm just trying to say, think broadly, think away from where everyone's focusing, and you'll be surprised with the results. Lower back, when you're sitting, bring your nose to your knees, kind of a thing. So bend forwards all the way and come back. That's a very simple, straightforward exercise while sitting down. And you can be rotating. When you're rotating again, that's a very thoracic movement that's happening. Just think common sense. Again, back off from exercise which is causing pain, because out of these, some could cause pain. Back off from them. Carry on with the ones that you can, feel better, and revisit those exercises that are probably hurting. So that's it.
Wow, very interesting. One joint up and one joint below. Move the joint,
That's it.
move the muscles.
Yes.
Very nice.
It's like a family, think about your grandparents and your, grandchildren, kind of a thing. So things are going to be okay. So, yeah, one below, one above.
Yeah, very true. Very nice.